Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, we are from the 9 English course group of Universitas Negeri Makassar. We will present our group assignment which is about social phobia. For the first, we will talk about the definition of social phobia. Do you know what is social phobia? Social phobia, according to the American Psychiatry Association, can be defined as excessive, irrational fear and avoiding social interaction or situation that involve performance in front of others, evaluation by others, and possibly negative consequences such as embarrassment. Apart from social phobia, several topics, namely introversion, shame, social withdrawal, behavioral barriers, and social performance anxiety. They are almost the same as social phobia, and from some children, they cannot distinguish. According to research overall 2017, children with social phobia as the age experience difficulties, but social difficulties and academic difficulties, but are different in the home and family environment. Alban Silverman and Rabian says the several topics as the same of social phobia. The performance above is usually representative of non-clinical population or still performance well in everyday life. Conversely, social phobia is a term representative of a clinical population because of its characteristic as excessive or functional, persistent, developmentally unstable, resistant to rational arguments, and social phobia is not a trait but a mental condition. Thank you.
As a second speaker, I will talk about major characteristics of youth with social anxiety and social phobia. First character is epidemiology. Although social fears are common among youths, the exact prevalence of childhood social phobia is unclear. As such, older epidemiological studies covering many childhood behavior disorder reveal a wide range of prevalence of DSM-3 or DSM-3R. Child had social phobia with most figures around 1 to 4%. Second is demographic characteristic. On this topic is divided into 4 parts including gender, age of diagnosis, level, and onset, socioeconomic status, and race and culture. A large majority of psychometric studies of child self-report measures indicate that girls report significantly more social anxiety than boys, especially with respect to fear of negative evaluation. Third is symptomatology. Children with social phobia have been found to display various symptoms. This often includes somatic complaints, general fearfulness and anxiety, depression and suicide, selective mutism, externalizing behavior, problems, substance use, and school refusal behavior. Fourth characteristic is diagnostic comorbidity. As one might expect, given the discussion so far, children with social phobia are often described as having a wide swath of comorbid diagnosis. Empirical evidence for this comes from 2 types of diagnostic studies. First is those focusing on youths with various anxiety disorders, and the second is those focusing more specifically on youths with social phobia. Fifth characteristic is general impairment and avoidance. Adult studies indicate that social phobia is associated with decreased quality of life as well as school dropout, unemployment and reduced work productivity, alcohol abuse, depression and suicidal behavior, other anxiety disorder, restricts social interaction and satisfaction, and various other occupational, academic, and social impairments. Sixth characteristic is peer relationships. Social anxiety can hinder peer relationships in various ways, like inhibiting the development of new friendships, facilitating ridicule and exclusion for peer groups, generating poor perception of one's social qualities, and impeding the development of adequate social skills. I will explain you all about the etiology of social anxiety and social phobia in youth. First are risk factor for youth with social anxiety and social phobia. 1. Biological susceptibility. 2. Character inhibition of behavior. 3. Other biological variables such as behavioral inhibition or high reactivity in children has been associated with increased 3-methoxy 4-hydroxyphenylglycol or MHPG, cortisol, heart rate, and sympathetic nerve system activity, right frontal activation, and right frontal cephalograph asymmetry. Second are general psychological tendencies. When children possess information in negative way, over time, they may practice excessive escape and avoidance strategy to increase personal safety and thus fail to accurately evaluate their thoughts in anxiety-provoking situations. And the last, characteristic of parents and families. Parents of anxious children are often described as controlling, partial, intrusive, loving, overprotective, demanding, encouraging avoidant behavior, preventing proactive or prosocial behavior, and or anxious, withdrawing, avoiding, and isolating themselves socially.
I want to tell you about research-based assessment of social anxiety and social phobia in youth. The first assessment is interview. Currently, standard for assessing anxious youth, including social phobia through structured interview, is anxiety disorder interview schedule for DMC for child and parent person. The second is child self-report questionnaire. Self-report questionnaire have subjective and internalizing nature of social anxiety. The third is social phobia and anxiety inventory for children. SPY have three validity: convergent validity, construct validity, and discriminant validity. The fourth is parent and teacher questionnaire. Parent and teacher can use to measure children's behavior related to social phobia and social anxiety. The fifth is family assessment measure. Family is giving a more intensive and specific assessment, and there are still some assessments that can be used for social anxiety and social phobia in youth. There are social anxiety scale for children, behavior assessment test, self-motoring procedure, cognitive assessment measure, physiological.
I would like to discuss about clinical assessment of social phobia in youth. The first is screening. Screening is aimed at potential social phobias by asking questions to look at the problems and help structure formal evaluations. Information about age and gender is very important because it will affect all aspects of research. Furthermore, looking for information about the nature and form of anxiety behavior, knowing the history and time frame of the problem of the extent of the symptoms in order to know the treatment that needs to be given. Therefore, it is also necessary to know about the areas and roles of the children who are being disturbed. Second is formal evaluations. There are many points. The first is interviews. Second, children's self-report questionnaire. Third, parent and teacher questionnaires. Fourth, behavior observation. Fifth, daily assessment method. Sixth, contacting school officials. And seventh, synthesizing assessment information. And the last is consultations. In these sections, there are 4 points. First, summarizing the findings of the assessment that still exist. Second, providing rational treatment. Third, pre-treatment considerations. And fourth, general care considerations.